I'm Connie Guan with the Healthcare Robotics Lab at UC San Diego. Our work explores the design of embodied technology for people with dementia and their caregivers with a community health lens. Dementia is a category of diseases characterized by progressive impairments in cognitive function, which can lead to isolation and loss of agency in people with dementia. Informal caregivers provide the majority of support, yet worldwide are overburdened by a huge lack of social and financial support. Researchers across many disciplines are exploring new ways to support both populations. Current HCI research adopts a critical dementia lens, which examines dementia's social construction to understand embodied expressions of personhood via music, art, and other experiences. Meanwhile, in public health, researchers consider how social determinants of health, such as racism, classism, sexism, and ableism, can impact health equity for both caregivers and people with dementia, and explore methods to address them. Our question then is, what lies at the intersection of these two approaches to dementia care? With this framing, our first research question is, how can we design sensory and embodied technologies to promote agency in people with dementia and alleviate caregiver burden? Second, how can we incorporate community health care practices into dementia technology design to advance health equity? Over a year and a half, we engaged in a three-phase research process. From our prior work, we knew that meal times can be very difficult, as people with dementia may need repeated reminders or assistance to eat. With this as our initial problem space, we iterated on designs and finally settled on a radio design probe intended to help during meals. It plays music to incorporate music therapy, has a robotic arm to mimic an eating motion, and resembles the familiar radio design. We used this probe in our later two stages of research to get participants to reflect on their care practice and then envision future technology. We conducted a thematic analysis of our data, which yielded 4 themes, which I'll briefly introduce. The first theme was that professional caregivers structure interactions to affirm the self-agency of the person with dementia. They might ask, how do you feel about breakfast? Rather than what did you eat for breakfast, to let someone with dementia express themselves without having to rely on their memory. There's an opportunity here to design interactions that are similarly tailored to reinforce the agency of the person. The second theme was that emotional well-being and task assistance are interdependent concepts. One of the hardest aspects of dementia care is supporting the emotional well-being of the person with dementia during care tasks. A person with dementia might get frustrated at being told what to do, which frustrates the caregiver, and now with 2 frustrated and stressed people, the care task is only harder to accomplish. Here, technology could use a sensory experience like music to keep the person with dementia calm during tasks and relieve some of that burden from the caregiver. Alternatively, it could provide prompts to the caregiver to help them reorient themselves and the person with dementia back to the care task in ways that are more effective. The third theme is the importance of using nonverbal embodied cues to communicate with people with dementia. Educators teach caregivers to use action mimicry cues instead of verbal explanations, as these are better understood in late-stage dementia. For example, seeing a caregiver eating can often jumpstart their actions and help them follow along in ways that verbal prompts can't. Technology designs can employ nonverbal cues to help communicate actions with people with dementia. Finally, our participants envisioned various roles that technology could serve to support the dynamics between the caregiver and person with dementia. For example, mediating interactions as a motivator to promote positive interactions, or as a respite provider to give caregivers a break. Technology could also support conducting specific tasks, either as a facilitator that helps people with dementia perform tasks themselves, or as an educator for caregivers to model useful caregiving practice. There are 2 key takeaways from our work. First is the importance of designing technology for nonverbal embodied communication. This allows technology to adapt to changes in the brain, as language can be difficult in later stages of dementia, but sensory and embodied experiences are retained for much longer. Building this kind of community care practice into technology is one way designers can align the use of technology with the work being done in community health. Our second key takeaway is the opportunity to address health equity by designing for the community health system. We've identified 3 areas where technology can support the ecosystem of health workers. The first is access, which we often view in terms of how technology can help individuals access community resources. Here we can envision how technology can make community resources like art therapy or support groups available to people in their homes. The second is education and supporting caregiver educators. Perhaps educators could provide caregivers technologies to guide them during care tasks and help reduce their cognitive load. Finally, the third area is expanding the reach of the community system, where technology can expand the ability of community workers to scale their existing support programs. Ultimately, we hope our work can provide one of many starting points for future design research to draw on community health frameworks to tackle complex social issues like health equity. I'd like to thank my collaborators and sponsors, and I'm happy to take questions.